Hi everyone, this is Danielle Zanzarov with Get Naturally Healthy. I am very excited to be joined here today by Dr. Leonard Fazio of Holistic Smiles. Hi Dr. Fazio.
Hi Danielle, thank you for having me.
I'm very excited to have you here today because our teeth are obviously very important and our oral care is extremely important for our natural health. So I have tons of questions for you. Are you ready?
Fire away.
Okay. So first, Dr. Fazio, I have to ask you about a very important question that seems to be pressing these days, and that is around fluoride. Can you give us your take on fluoride?
Sure. Fluoride has the potential for becoming toxic if ingested in high enough amounts.
Okay.
The concern that the average person might have with fluoride is that if they are very compliant and brush their teeth on a daily basis, that they could wind up inadvertently ingesting fluoride.
Okay.
And if they're good little boys and girls and they do it multiple times a day, this could lead to a significant body burden of fluoride, which will accumulate over time.
Right.
In high doses, it is very well known that fluoride is toxic.
Okay.
In fact, the only other commercial application for, or commercial use for fluoride is in the pesticide arena. So
Yes.
we know that it's very good at killing things that we don't like. And in dentistry, we are under the impression that it's absolutely 100% safe and effective in the use for battling against tooth decay. Realistically, its effect can be had by killing the bacteria that are associated with tooth decay rather than the actual strengthening of tooth structure against tooth decay.
Okay.
I think it's very important that people should question whether or not their total fluoride exposure could become an issue for them down the road. And the reason this is important is because there are many sources of fluoride. It's not only coming from toothpaste. It can come from, depending on where a person lives, from the municipal water supply, so they could be drinking with it, cooking with it, showering with it, and therefore getting systemic exposure, which again we're concerned about for the long haul.
Yes.
So I'm personally not someone who advocates fluoride. I don't use it on my children. A lot of the new patients that come in here or have already made up their mind that they would like to find other strategies to prevent tooth decay that don't rely on fluoride.
Okay. Can you tell us about some strategies that people can use to prevent tooth decay?
Yeah. One of the first things we would look at will be diet. So dietary and nutritional recommendations, which could include including more vegetables in the diet, which are alkalizing foods, or any foods that are alkalizing. That could be certain citrus fruits and others, which would help to regulate the body's pH level.
Okay.
The idea would be that if we can keep the body's environment from becoming too acidic, then it's much more difficult for cavities to form.
Yes.
It's much more difficult to be sick in any degree. So that's one of the first things we'll do. With children, that's not always so easy. It's easier said than done. But one of the other things that we're looking at for parents to use for their children is the use of xylitol, which is a naturally occurring sweetener.
Okay.
Comes from berries. Doesn't sound like it should be preventing cavities because it's a sweet product, but in fact it actually has the exact opposite effect on the body, which is to create an environment that is more resistant to cavity formation. It changes the pH environment in the mouth.
Okay.
And so it can be taken in chewing gum form, it can be taken in crystalline form, like which looks like table sugar, and put into foods or a juice and be taken internally. That would, like I said, take a more roundabout way of providing cavity protection. So it's not necessarily applied topically, although it can be with the toothpaste. With toothpaste that contain xylitol.
Yes.
And also with the bubble gum flavored gum that most kids like. And then taking it systemically kind of covers all the bases. The best thing about it, no chance of toxicity. Whereas with fluoride, you could very well wind up with some potentially toxic effect.
Right. So what else in terms of an alkaline diet, xylitol, like what should people's daily hygiene routine, oral hygiene routine
Well, I
be?
mean, there's no substitute for good oral care. Brushing well with a toothpaste that is also non-toxic, but yet is going to do the job as far as physically cleaning the teeth away. That's that's always part of the equation, and we can't overlook that. So good home care is essential.
Yes.
But we realize here in the office it's not the be-all and end-all of cavity prevention. There's plenty of people who do well with their home care and who still wind up forming cavities. One explanation might be that there is a genetic component to this as well. Some
Okay.
people are just going to be more susceptible to developing cavities, and therefore, despite their best efforts, will wind up developing cavities all the same. As it turns out, just to give you an aside, a friend of ours of the office, who's a naturopathic physician, has two children who grew up with the same diet. One child got a lot of cavities, the other one not so much, and he was perplexed as to why this is happening, even though the kids were getting their teeth cleaned frequently and had an ideal or similar diet. He was able to explain this by, after reading a book called Eat Right for Your Blood Type, written by Dr. Peter Diadamo.
Okay.
And he found out that one of his children excreted the antibodies to guard against cavities in his saliva. The other child did not. He was classified as a non-secretor of the antibodies, and therefore was more prone to the cavities. So there was something that was beyond his control, and that child who didn't secrete the antibodies did wind up developing the cavities. So to some degree, there's no control over that. But brushing well, using a fluoride-free toothpaste would probably be ideal in that it not only will clean the teeth, but it will not subject the user to potentially toxic materials.
Okay. Are there anything specific, or is there anything specific that people should look for in a toothpaste?
I'd say they should read the ingredients list and find out, if there's any words in there they can't really pronounce, that it might be something to stay away from. Fluoride-free toothpaste will have to say it in very bold letters on the tube or on the package.
Okay.
I would recommend, especially for children, that even though the American Dental Association says fluoride toothpaste is recommended, that parents consider not using fluoride toothpastes. I think the difficulty lies for children in that to find something that they can use and I'll use the word enjoy or tolerate, because a lot of the fluoride-free toothpaste have a strong either herbal or medicine-y type taste.
Okay.
I think it's great, but most kids won't be inclined to be wanting to use it. But there are a few out there, and a lot of it's trial and error. We tell our parents, try one. If the kid uses it, great. A lot of our patients will bring them to us, and I'll look them over and give them my thumbs up or seal of approval.
Okay.
But generally speaking, shopping in a health food store or a similar location would provide you with the best option for finding a natural toothpaste which has helpful ingredients.
Okay. And what about mouth rinse? Like, do you recommend that people rinse with salt water, or is there mouthwash or?
You can. In fact, if you wanted to make up your own truly natural mouth rinse, a saline solution, perhaps with some hydrogen peroxide thrown in there, as long as the peroxide was diluted, is a safe and effective mouth rinse. There are commercially available rinses, and again, the key is to look at the ingredients in there. If you go to a health food store, you'll likely find something that's truly natural, that has the ability to kill off bacteria, reduce the plaque or bacterial film, and therefore keep the mouth as clean as possible. In our office, we have a product that's herbal and essential oils based.
Okay.
And we're pretty happy with that product because it is truly natural and achieves the effect that we were looking for, which is to keep bacterial counts to a minimum, but also to address inflamed gum tissue. So it calms down the inflamed gum tissues and helps to eliminate the gingivitis for long-term stability of the gum tissue.
And what is that you like to use?
That one is called, very simply, it's called the Tooth and Gums Tonic by the Dental Herb Company. That particular product is only available in dental offices, and we can barely keep it in stock because once people start using it, they just love it.
Interesting. Great. Thanks.
Okay.
So you mentioned hydrogen peroxide.
Yes.
I think that's a great segue. A lot of people are concerned. We're all drinking green smoothies and green tea to keep our health in check. What about staining of our teeth? How do we keep our teeth white?
Peroxide is one of probably the easiest things to use. Now, perhaps mixing peroxide with some salt water and baking soda
Okay.
You could make it into a paste, which would be very gentle, but yet very effective at removing extrinsic or external stains brought on by foods, perhaps even persons who smoke. But caffeine and blueberries and red wine and all the other things that tend to accumulate on the surface of teeth can easily be removed by the oxidative effect of the peroxide.
Okay.
Pretty simple, pretty safe as far as chemicals go. Peroxide is very effective at removing it without damaging the tooth structure. So even in professional whitening formulas, for those who are looking to get their teeth as white as bright as they can, if used according to directions, peroxide will not cause any long-term effects in the mouth. We're only concerned when people take it straight out of the bottle and they start swishing it around, because it'll certainly whiten things, but it could also disturb the balance of good bacteria and bad bacteria in the mouth. It'll kill off too many things and then wind up having, usually as a side effect, people wind up having a bacterial infection that can ensue afterward.
Wow. Okay. Now, here's a hot topic for you.
Yep.
What is your take on mercury and mercury fillings?
My take is they have no business being in the human body.
Okay.
After personally having suffered from a toxicity issue based on my exposure to mercury fillings, and then compounded by an occupational exposure, I'm a much healthier person now for not having those fillings in my mouth. That time in my life when I first discovered this information was very life-changing, and as a result I changed my practice to not involve those fillings or to not offer them anymore, because I have the personal opinion,
Right.
and there are plenty of others who have the same opinion as I do, that these fillings are not appropriate for use.
Okay.
Even though they are durable and they last a long time, the potential for harm, not only short-term but certainly long-term, is very real. And in our practice here, we have patients who come specifically for the purpose of having those fillings safely removed and replaced with materials that we feel are more biocompatible. So the options are out there. There are alternatives, and right now it becomes a matter of the patient doing his or her research to decide, does that sound like it's something appropriate for them? We do not tell people that they should or should not have those fillings, but the information is widely available on the internet for persons to decide on their own whether they want to take a material that is mostly mercury mixed with other metals and have that implanted in their teeth. So in our office, it's not an option, it's not available, but when it comes time to removing those fillings, it's done according to a very specific protocol designed for the patient's protection, so as to not expose them to significant amounts of mercury during that process.
So it's not like you can you just go to any dentist to have your mercury
Not likely,
removed?
Danielle, only because even if it would be done, unfortunately I've seen way too many persons who have done exactly that, and without any precautions in place for the safety of the patient, those patients wind up getting a significant exposure to mercury, and for some of those persons, an illness that is pretty permanent. And so there's no way to pre-screen someone and say, all right, if I remove 4 fillings from your mouth, that you'll be fine.
Right.
It happens all the time. People seemingly have no side effects from the removal or replacement of amalgam fillings, but then there's a significant portion of the population that do react. Sometimes that reaction is not apparent right away, but it is becoming more of a cumulative event, and therefore maybe months or years later, they're actually beginning to express symptoms that might be related to a dental history. So the dental exposures that come from the placement of the fillings, from having the fillings in the mouth, and then ultimately from replacement or drilling out of old fillings, will become a cumulative event. And the human body does very well at storing heavy metals in the body. It's a much harder thing for those persons to excrete that stuff, and therefore over time it winds up building up, and depending on one's genetic predisposition and lifestyle, could result in actual disease states forming.
So it's important then to have someone who's trained
Absolutely.
in mercury removal.
Absolutely. Again, the precautions that are put in place, not only inside the mouth, but in the treatment room itself, is designed, in our office here, is designed for the safety and efficacy of the patient, also for the safety and protection of our staff as well. The next person that comes into a dental treatment room should not be exposed to any materials, chemical or otherwise, that the patient previously in that room was having removed. And so in our operatories, we have a very simple but effective way of kind of clearing the room, flushing the room, if you will, of any and all remnants of toxic materials that might have been exposed in that previous treatment.
Okay. So speaking about fillings, let's shift a little bit to
Sure.
cavities.
Yeah.
So what should people do when it comes to cavities? What is the optimal treatment for cavities?
For children, in our office here, we're very conservative. And many times, my basic philosophy is that the less invasive we are, the better it is for the child, the better it is for the tooth. And in many cases, we will not treat cavities if we feel that the primary teeth or baby teeth are ready to fall out.
Okay.
But in cases where a cavity is formed in a baby tooth and we know that that tooth's going to still remain with that child for a number of years, sometimes we have no choice but to perform an intervention and drill and fill that tooth. In our office here, we're very concerned about the types of materials that are being used in that process, not only the type of local anesthetic or Novocaine that's being used, but also the bonding agent and the filling itself. We use a material called composite resin, which is a tooth-colored, non-metallic filling, and of the one that we use, we feel is the safest out of the literally thousands of tooth-colored fillings that are on the market today. And the idea being that these tooth-colored fillings are essentially high-tech plastics. We're going to be very judicious in selecting the plastic ceramic material that has the least amount of potential for harm, meaning that it will not outgas things that could cause the patient to have some other sensitivity reaction. We do not use fillings that contain fluoride or bisphenol A, BPA.
Okay. So what happens though when a cavity gets a little bit out of control and you end up with a situation of a root canal?
Okay. Traditional dentistry would recommend a baby root canal tooth treatment for the tooth, which would involve physically removing the nerve and blood supply, which we call the pulp, physically removing that from the tooth, and then in an attempt to sterilize it, wash it out with some sort of agent ranging from sodium EDTA to household bleach. The idea is that we want to sterilize any bacteria that might be associated with that infected tooth, then seal it up, much like putting a cork in the bottle. The idea being that the tooth could be retained on, if it's a primary tooth or baby tooth, if that tooth can be retained for the duration, then it holds the space open for the adult tooth that's going to erupt later on. In cases where that is done or the tooth abscesses, then it becomes sometimes a little more difficult to manage, and probably for the benefit of the patient, it would be best treated by removing the tooth. Removing the tooth is the one true method that we know that we can physically remove all remnants of infection from the body. When we perform root canal therapies, whether it's on an adult or a child, we're in effect essentially forcing the body to hold on to an otherwise dead tissue. There are very few, if any, other indications in all of medicine and dentistry where we force the body to hold on to dead tissue. Root canal therapy is one of those. Once the tooth has been treated with root canal therapy, it's essentially a dead root, but yet we're telling the body it must hold on to it. We restore it, we put a cap on it or a bridge on it, and expect that the person will retain that tooth forever. The effect that has on the body can be very far-ranging, from no symptoms to discomfort, or possibly even implicated in a whole range of diseases. There's evidence to suggest that root canal treated teeth might be a role player or cofactor in the onset of autoimmune disease or cancer, and therefore in our office, when pressed or presented with a situation where root canal therapy would normally be indicated, it's very important for our patients to get a full education on the issue. It is a very controversial one, but the idea being that once the patient has all that information, they can decide what's best for them or for their child.
Okay. So one last question with regard to x-rays, because there's a lot of concern over radiation exposure.
Okay. From a medical legal standpoint, dentists are required to take x-rays on their patients just so that at no time does any pathology, disease state, cavity, or whatever you'd like to call it, go unnoticed and untreated. In many cases, we're very limited with our ability to spot or see all cavities that are forming, especially when they form in areas between the teeth or below the gum line.
Okay.
X-rays do have a very good value in providing that information and helping us to see things while they're in an early stage. And so the old adage that early detection is key is greatly helped by the use of dental x-rays. On the flip side, we know that X-radiation creates some problems for our cells in our body. So in our office, we would normally be very selective, judicious, if you will, in the schedule that we insist on for x-rays. With children, we would generally try to go low and slow. By using digital radiology in our office, we're able to reduce the amount of radiation for each particular x-ray film that's taken, and therefore reduce the amount that the average person is exposed to. That trend is continuing to all dental offices, holistic or otherwise, and therefore in our office here, we give the parents a say. If there are cases where we're suspecting something, well, we might order just one film instead of 19.
Right.
Or we might say, okay, instead of every year, we'll go every other year. But we tend to take that on an individual basis, based on a person's kind of progress. Some kids are big cavity formers or fast cavity formers in adults, and for those persons they would ultimately require more frequent x-rays. But we tend to make recommendations for persons who are expecting x-rays to be taken that they can do ahead of time. One of the simplest things to do would be to load up on antioxidants prior to coming in, because one of the things that x-radiation does is create free radicals in the body, and the best way to scavenge those free radicals up before they have a chance to cause more cellular damage is to have high amounts of the antioxidants in the bloodstream. Vitamin A, vitamin C, vitamin E, selenium, resveratrol, all those things could be taken prior or loaded up on prior to the dental visit, so that if the radiation is accepted and received by the body, the side effect or undesirable side effect is minimized.
Fantastic.
Okay.
Well, Dr. Fazio, thank you so much for your time.
It's my pleasure.
You are my dentist, my husband's, my children's, and we're so glad to have you as our dentist. And for those who do live on Long Island, can you share with us a little bit about where you're located and
Yes.
how people can contact you?
Presently, we're located in Port Jefferson, not in the village, but a mile south of the ferry on what is called Main Street, also known as Route 25A. We're located in the Pen and Pencil building with plenty of parking out front, so it's one of the few places in Port Jeff where there's ample parking. Our website is one of the best ways to get information on everything I've spoken to you about, and location, office hours, and such. And if you would please visit www.holisticsmiles.com, you can get any and all information regarding our office hours and policies. It'll also give you links to other websites which echo our sentiments when it comes to medicine and dentistry, and also a lot of great information from the content on that website. Our office hours typically are Tuesday through Thursday from 9 a.m. until 6 p.m. and then Fridays and Saturdays we're here from 9 until 2. The office will be closed on Sundays and Mondays, but there's always facility to get in touch with me if there's an emergency that arises during the off hours or on the weekend by calling our office phone, which is area code 631-474-7477.
Great. Thank you so much for your time
Danielle.
today.
All
Thanks.
right. Awesome.